All right, can everyone see? Okay. So I'm just going to kind of go down this list of the most common resources that I refer folks to. So we are serving the Clackamas County area. However, occasionally we do get folks who are in Multnomah County or nearby. So the first place that I have found really important, a really important resource, is just the Clackamas County Mental Health Center. So, okay. So essentially what this is, it's through the county. All of the services are free. They have a 24/7 crisis and support line. So if someone is in a mental health crisis, this is a line to call. They offer free confidential support. The staff is fully trained and they know how to de-escalate and help someone work through a mental health crisis. They also offer suicide screening and can help folks create a safety plan. Yeah, so that's always available. There's also the Clackamas Mental Health Walk-in Center. So if someone is experiencing a mental health crisis, they can just walk in to the clinic, which is in Happy Valley. And they have all sorts of mental health care professionals. They have case managers, peer support specialists, medical professionals. They are able to offer brief counseling services, and they also offer peer support. They also, in some situations, they can actually provide temporary medication if for whatever reason someone is unable to get the prescription that they need. Maybe they moved and they're not able to get their prescription right away. In some cases, they can offer that service as well.
June, can you show us what the website looks like by any chance?
Oh, can you all not see it?
I'm not seeing it. I see your list, but I don't see the website.
Okay.
I don't know if I'm the only one, but.
Okay, can you all see the website?
No.
No,
I think it's the list on your website, I think is what we're seeing.
Oh.
Yeah, you might need to go to a different screen. I don't know. You should.
Okay.
You shouldn't have to, but you might need to. I don't know.
Okay.
Yeah, you might need to stop screen sharing and then rescreen on the other.
Oh, okay. I thought I was going to be able to just click on the links and then it would.
We were able to do that at one point in time, weren't we?
Yeah, I think you should open it in the browser instead of Adobe application.
Okay. Here we go.
I had a question when you have a minute about the training. I put it in the chat.
Okay, thank you. Okay.
I will take a quick look at the chat and we'll see what we got.
Can you all see it now?
Yep.
Yes.
Yes.
Perfect. Okay, so I'll just have to stop screen share and then reshare it each time I open a page. That's fine. Yeah, so as I was saying, they offer the 24/7 crisis support line and the walk-in center. So this part of it is really important. They have a mobile crisis response team. So if someone in the Clackamas County area is having a mental health crisis, this is a really good alternative to calling 911. They have mental health first responders, including peer support specialists, social workers, people trained in crisis de-escalation, and they're able to go and meet someone where they are and be there for them and provide that face-to-face interaction that can be really helpful for de-escalating situations.
So the question in chat, June, is do you know what kind of training, maybe even how many hours that the people put in that are working the crisis line?
It really depends because some of them are peer support specialists. Some of them are social workers. So you could have somebody with like a master's degree in social work, or you could have someone who, the peer support specialist training is usually like 80 hours. And then there's like a test and everything. And then there's also on-the-job training, although I'm not sure how long the on-the-job training lasts. So yeah, I'm not sure, but I can look into that.
Thank you.
Okay. Okay. So the next one I want to share is Cascadia Mental Health Services. So I'll just type it in here. Okay. So Cascadia is really great. It serves not only Clackamas County, I believe it serves Clackamas County, Multnomah County, Washington County, and they provide tons of different services. So you can go there to get your mental health care needs met, even your physical health care needs met. They also offer housing resources, so case managers who can help you find housing. They take Oregon Health Plan, and if you're uninsured, they also have a sliding scale for all of their services. And they also have case managers who can help you. They're called OHP assisters, who can help you apply for OHP and get on it. So I'm just going to go through a few of the resources that they provide. Okay. So for mental health treatment, they offer comprehensive assessment and treatment planning, individual and group counseling, case management, skills training, supported employment, education, and medication management. They also offer peer support, and they can just offer a variety of services to people who are experiencing mental illnesses. Okay, and then for housing, they offer affordable housing. So they actually have affordable housing through their program. These are for people who are experiencing disabilities or mental health conditions. And then they also have permanent supportive housing, which would be like if somebody had a mental health condition or a disability in which they needed continual like supervision, medication management, things like that in their home. And then they also offer inpatient residential treatment programs, which are usually temporary, and it's a way to just get stabilized, get on the medication that you need, and things like that. So it's a really great resource. Okay. And then there's also Project Respond. So this is through Multnomah County. One moment. Okay. So Project Respond is similar. Can you all see it?
It's a little bit off the edge.
Okay. So Project Respond and the Behavioral Health Crisis Intervention is very similar to the Clackamas County Mental Health Center. They offer a 24/7 mental health crisis call center, and they also have an urgent walk-in clinic as well, which is actually through Cascadia. They also have, so Project Respond is their mobile team. So if somebody is located outside of Clackamas County, if they're in Multnomah County, then I refer them to this line if they're having a mental health crisis, or the walk-in center. Does anyone have any questions so far? All right. So the next one I will share with you is called LifeWorks Northwest. Okay.
Yeah, I just asked a question in the chat.
Oh, okay.
So you can go ahead and ask your question directly if you'd like.
Well, I typed it out.
Okay, so the question that she has is, how easy/difficult is it to get doctors to prescribe medication? In Humboldt County, there are very few psychiatrists, and this question comes from our participant in Albany, California.
Okay. Yeah, so here in Oregon, it definitely depends on what health insurance you're on. I can speak most to Oregon Health Plan and how that works. So, with Oregon Health Plan, you will often be given a behavioral health plan as well as, you'll have your primary care provider. Oftentimes, people who are on OHP get prescriptions actually from their primary care provider. And they might do like a screening, like a psychiatric test, and give you a diagnosis. And then in my experience, they are fairly quick to prescribe medication. But a lot of the times it's difficult to find psychiatrists like who specialize in psychiatry on OHP, because a lot of the mental health care providers are counselors, like licensed professional counselors, social workers. But yeah, and I think with Medicare though, most of them are like psychiatrists or psychiatric nurse practitioners. So it really depends on what your health insurance is. Is that helpful at all?
Well, in Humboldt, I don't know, you must have some pretty rural areas out in Oregon that have, no psychiatrists in the area. What do those people do for prescription medication?
Yeah, so well, these days we have, because of the pandemic, a lot of stuff is happening remotely. We have telehealth services. So at this point, it's pretty easy to get the services that you need, regardless of where you are, as far as I know.
Now, do you have telehealth services, or are you aware of them down in Albany?
Oh, my daughter lives up in Humboldt. I live in Alameda County. I'm next to Berkeley, so I'm just, knowing what goes on in Humboldt. That's why I'm asking those questions.
Gotcha. Well, if they would probably want to take advantage of whatever telehealth services are available in Humboldt County, and we have to presume that there would be some, because especially in rural areas, they've really tried to manage that post-COVID. So there should be, and that should be the way for them to access what they need.
Yeah, it's just very difficult.
Yeah, I've heard it can be really difficult.
I have a
Yeah,
question.
it just takes so much time.
Mm-hmm.
Excuse me.
I'm
In order
sorry.
to get the psychiatrist, it takes so much time to get the psychiatrist, and then by the time you get the prescription, and it takes however many weeks for it to ramp up, a lot of time goes by.
Mm-hmm. Yeah, it's a very common problem. It can take a while, and that's part of the reason why we have these crisis centers that are sometimes able to provide short-term medication, like if it's an emergency. But yeah, it can definitely be difficult.
And, that's one of the reasons why our peer support groups, which there may be in Humboldt County, our peer support groups are so important, is that while you are navigating that whole process of finding a psychiatrist, finding the right medication, playing with the dosages and the different kinds of medication to find the right mix for you, it can be incredibly frustrating and challenging when going through that. And so it's so nice to be able to go to a group where you know that there are people who either are already or are currently going through that, or have at least gone through it recently. And so though I would strongly recommend the peer support group to whomever it is that is trying to go through that process. And peer support groups now are pretty open throughout all the NAMI affiliates. So if they're not offering one in Humboldt County, I can guarantee you that you're welcome to come to one in Clackamas County virtually. And there are lots of other ones like that too. So please don't stop when you get to Humboldt County and there's not something that meets your needs. Keep looking. There will be something. And if you have challenges finding something, you can always connect with us and we can help you do that.
Definitely. Yeah, I often refer folks to, because a big part of what I do is I actually look for psychiatrists or the sort of mental health practitioner that they're looking for that takes their insurance, and find ones that currently have openings so that they don't have to go through that long wait, because it can be really hard to find them. You have to kind of know the ins and outs of the websites, and yeah, it can take some digging.
I have a question. Can you hear me?
Uh-huh.
I'm Bonnie Wolfman. I'm calling from Jackson County. And I've been an advocate for my son for years and worked with 2 states, Oregon and California, and trying to do a faith-oriented support group here. Been through training with leadership and all kinds of. So if this position that you hold, is that just in that county? I mean, would that be something that could be established in another county as well? Because I don't think we have a peer type of coordinator situation. Is that something that could be, I could approach maybe the county here or NAMI here or what have you from that faith perspective?
I think so. Yeah, I know that Clackamas, NAMI Clackamas is unique in having the peer program, as far as I'm aware. That's true, right, Gary? I think it might be worth reaching out to other NAMI affiliates and suggesting it. I think other affiliates kind of focus on other sorts of services, like
Sure, yes,
some of them
I
have
know.
helplines, like people that do helplines. But
Right.
yeah, I think it's so important to have that resource, to have like peers that can help navigate, finding welfare benefits and things like that. I think it's important. But yeah, I don't see why not.
I had a friend that had that in Reading. It was private, but she was the resource for all of it. She just had people come and do an assessment. She had worked with the county for years. So I'm looking at something like that for Jackson County because there's nothing. So
Yeah, okay.
it would be really nice to have. Anyway, so this is helping to kind of formulate some ideas. So thank you so much.
Well, and Bonnie,
Yeah.
I would also say from our perspective up here, yes, June is right. There really aren't a lot of, there are, I think, a few, although I don't know which ones they are specifically, who do have similar services. They may not call them a peer resources coordinator. So I would ask them for someone for either case management or navigation services as well. They might not call it a peer resources coordinator. But I can tell you that we've struggled with funding for this position because it's not a volunteer position, it's a paid position. And that's really the only way to make it sustainable. So the one thing that the NAMI organization would need is funding. The county would be a great resource for that. And I'm sure that your local NAMI would love to hear from you about being an advocate for that particular program, especially with the county, because that's where the funding will come from. And, if you know anything about NAMI, we have 700 affiliates around the country.
Yes.
Most of them are associated by county because that's where the healthcare funds come from. But all of us are individual entities who came to NAMI rather than being established by NAMI, which means we all have our own personality, we all have our own capacities, and so many, I would say 80% of the affiliates out there do not have staff. They're run totally by volunteers.
Right.
So they may not have the capacity to do the things that need to be done and may need to start a program like this on a volunteer basis. So
Sure.
that would be something else that could be looked at. Say, let's start it as a volunteer while we look for funding so that we can help people. But June will say that navigating the bureaucracy for someone who's not in crisis is traumatic many times, much less having someone in crisis do it. So giving that responsibility to a volunteer might be a heavy load to carry, but there are lots of volunteers out there that I know of that carry a pretty heavy load. So anyway, I hope that helps.
Oh, it does help completely. Thank you so much. All right.
Any other questions? All right. So yeah, the next resource that I often refer folks to is it's called LifeWorks Northwest. And what's unique about LifeWorks Northwest is that they serve clients of all ages. So it's a really great resource for youth, families, and people who are dealing with mental illness at any stage of life. So a few things about this program. It does take OHP, and they also have, so they offer basic mental health care, including counseling, support groups. They offer group counseling. They also offer medication management, like long-term medication management. They have both outpatient and residential care. And they also have a program that's called ESA, and that stands for Early Assessment and Support Alliance. So this is for people aged 12 to 14. If they're starting to experience symptoms of psychosis, they can receive individual or family support, education, advocacy, and treatment. So there's a really robust family component, and ESA serves individuals who are either publicly or privately insured, or who have no insurance. So yeah, and it's available to residents of both Clackamas County and Washington County. They also have, let's see, they also have many different locations. They have one, let's see if I can pull that up. Yeah, so these are all of their locations, Beaverton, Gladstone. They have the Hawthorne Walk-in Center, which is also a crisis walk-in center like the ones we talked about earlier. So there's just a lot of different locations out there. They serve a lot of different areas. And it's really great for both like crisis intervention as well as long-term support, mental health care, and case management. Okay. Okay, so the next one I'm going to share is called Evolve Peer Support Services. Just pull that up here. Okay, so this is through the Mental Health and Addiction Association of Oregon. Can everyone see it? Okay, so this is an organization, it's a program within the Mental Health and Addiction Association of Oregon. It's called Evolve. They specifically offer peer support services. So they have a team of certified peer support specialists. Again, these are people with lived experience with mental health conditions, addiction, various different things, who are trained to use their lived experience to provide emotional support, oftentimes logistic support, like helping with medication management, helping with things like grocery shopping, meal prep, things like that. So on this site, you can fill out a form here, which is just some information about who you are or who the person is who's looking for a peer support specialist. And you can specify like what sort of peer support specialist you're looking for. So you can have, if you have a preferred gender, and then you can put in your area of focus for support. So maybe it's for major depression or PTSD or substance abuse. And then you'll be matched with somebody who has lived experience and specializes in that area. You can also choose someone who has lived experience with any of these particular areas: criminal justice system involvement, DHS child welfare, addiction recovery, mental health. So you can just specify what you're looking for. And then you just submit the form and they will reach out to you and match you with a peer support specialist. So it's sort of like they're not really a mental health care provider. It's more of like an informal working together sort of relationship. Okay. The next organization I want to share is called Folk Time. So Folk Time is pretty unique. The main reason that I refer folks to Folk Time is that they have a lot of like social programs, just like events that you can go to and meet other people who are dealing with mental health struggles. Each month they create a new calendar with just different activities that are going to be going on. So you can just go to their calendar page, you can see what events are happening. And if I click on programs and I click on social programs, you can see here, so social programs are created by and for members. Folk Time is completely peer run. Everyone has lived experience. They have various different ones, like there's the Bliss Garden event, which is where people meet up and garden together. There's, you know, lots of like virtual meetings. Yeah, so there's different things that happen each month. There's also support groups. So they have, let me pull that up. Okay, so Folk Time has a support group called Hearing Voices. So this is specifically a support group for people who've had experiences with hearing voices. And it's whether they want to be on medication or don't want to be on medication. There's no sort of expectation of, yeah, you know, treating it or being on medication. It's kind of just a place where you can talk about your experiences in a non-judgmental setting. They also have a support group that's called SLOP, which stands for Suicide as a Language of Pain. And let me pull that up. So SLOP is a peer-led meeting. It's designed and facilitated by survivors, so people who have attempted suicide or who have had suicidal ideation. And it's just a place where you can go and talk freely about your experiences and just kind of what you've been through. Okay. Does anyone have any questions? All right, so the next one I want to share is just a resource that I often refer folks to. A lot of the people I work with are experiencing homelessness. So Love One is a nonprofit that provides laundry, meals, and showers. So if you go onto their website, you can find a calendar of events, and it shows where and when the free showers, food pantry, food giveaway events, as well as laundry events are happening. So you can just register and then you can just go and, yeah, get whatever you need. So it's really great, you know, if someone's experiencing homelessness and they need to like go to a job interview or something, it can be a really, really important resource.
And June, you know, this is exclusive. This particular one is exclusive to Clackamas County. And so that's why you'll see Milwaukee. But my understanding is there are other, if they're not called Love One, there are other services similar to this in other communities. And much like all of the resources that June is covering, and we talked about that a little bit in terms of a peer resources coordinator, if there, you may find them in your community called something differently, but if you don't, it certainly is worthwhile to advocate for something like it in your community. And I know that Love One, much like NAMI Clackamas and other NAMI affiliates, are more than willing to help you with whatever, or help whomever with whatever it takes to get them started.
Yeah, absolutely. And then the next referral is, so this is a line that you can call. It's called the David Romfrey Warm Line. And this is specific to Oregon, so it's not specific to Clackamas County or anything. But it's unique in that it is staffed by peers. So peer support specialists, people who have lived experience with mental health conditions, substance abuse, trauma. And I've just heard really great things about it. Oftentimes, can everyone hear me?
Yes.
Yes.
Oh, okay, I think I might have frozen for a second. So yeah, it's just it's a very unique line in that it's staffed by peers, and yeah, I've just heard that it's a really great resource. You don't have to call just if you're in a crisis. You can call if you just need someone to talk to for whatever reason. And it's less about, because a lot of lines you call and they screen to see if you are in immediate danger, things like that. This can be more of a thing if you're, even if you're not in crisis, but you just need some support and you need someone to talk to.
If somebody is traveling, can they just call these helplines even if they don't live there?
I think so, yeah. This is just a 1-800 number.
My experience with these lines is that they don't turn anybody away. They may refer you out to someone else for immediate assistance, but one of the reasons that we're in the mental health work that we do is that we understand when people are in crisis and when they're vulnerable, they don't need to be put off and sent elsewhere, if at all humanly possible. So I would venture to say they'd be more than willing to at least help you find something that you need.
Yeah. Yeah, I would agree. They are not 24/7 though, so their hours are just 9 to 11 every day. Okay. So the next place I'll share is Lines for Life. This is also an Oregon organization. So what's great about Lines for Life is they have different lines for specific groups. So they have a drug and alcohol helpline, military helpline, racial equity support line if you are a victim of racial discrimination, violence, senior loneliness line, and a youth line. And they are open 24/7. They're staffed by trained professionals, and they can just provide emotional support, safety planning, things like that. Okay. All right, so Clackamas Women's Services is an organization that is for people who have experienced domestic or sexual violence. They offer free support groups. And they also have case managers who are able to meet with people and create safety plans, help find temporary housing, help with advocacy, provide information, education, and everything's totally free. They also have a 24-hour crisis line. Okay. So as I said earlier, I often am helping people who are experiencing homelessness. So one of the most common referrals that I send folks to is the Clackamas County Coordinated Housing Access. So this specifically focuses on housing for people who are currently experiencing homelessness or are at risk of experiencing homelessness. And they can assess your needs. They have caseworkers that will assess your needs and then direct you to the correct applications, whether that might be supportive housing, it might be Section 8 low-income housing, it might be, just any sort of housing that you might be looking for that fits your situation, they will help you to find it. They also help you, so if you are at risk of becoming homeless, of being evicted, they help you with problem solving and resources to prevent loss of housing as well. Okay, so the last place I will share is Central City Concern. Central City Concern is, they actually provide a lot of different services. It's generally associated with housing, but they also offer healthcare, addiction recovery, and other resources. So one of the great things about Central City Concern is they offer project-based Section 8 housing, which if you know what Section 8 is, there's Section 8 vouchers and there's project-based Section 8. So a housing choice voucher is when you apply, and if you meet the income requirements, you can get a voucher, which allows you to pay 1/3 of your rent or 1/3 of your income each month towards rent, and then the voucher will cover the rest. Unfortunately, these wait lists are usually incredibly long. It can take years and years and years to get approved for a voucher. I've heard of it taking like 39 years. So right now, I believe that the wait list is actually closed in Clackamas County, but Central City Concern has project-based Section 8. So these are where you apply for a specific apartment and you automatically get the Section 8 benefit when you're approved for the apartment. So you just have to meet the income restriction requirements. They also offer like group housing. They offer clean and sober housing. They offer case management. And yeah, like I said, healthcare, and they also take OHP. Okay, so I think that is everything on my list.